Nasal polyp. What is a nasal polyp? Nasal polyp are fleshy swellings that develop in the lining mucosa of the nose and paranasal sinuses, air-filled spaces linked to the nasal cavity. They are non-cancerous growths. What causes nasal polyp? The mucosa is a very wet layer that helps protect the inside of your nose and sinuses and humidifies the air you breathe. During an infection or allergy-induced irritation, the nasal mucosa becomes swollen and red. With prolonged irritation, the mucosa may form a polyp. A polyp is a round growth, like a small cyst, that can block nasal passages. Although some people can develop polyps with no previous nasal problems, there's often a trigger for developing polyps. These triggers include A. Chronic or recurring sinus infections. B. Asthma. C. Allergic rhinitis. What are the symptoms of nasal polyp? Polyps can grow large enough to block your nasal passages, resulting in chronic congestion. Symptoms can include 1. Nasal congestion, a sensation that your nose is blocked. 2. Runny nose. 3. Postnasal drip, which is when excess mucus runs down the back of your throat. 4. Reduced sense of smell. 5. Breathing through your mouth. 6. A feeling of pressure in your forehead or face. What are the major types of nasal polyp? There are 2 major types of nasal polyp. 1. Antrochoanal, single, unilateral, originate from maxillary sinus, usually found in children. Infections is the common cause. 2. Ethmoidal, bilateral, originate from ethmoid sinuses, usually found in adults. Allergy is the common cause. How are nasal polyps diagnosed? A doctor will generally be able to make a diagnosis after asking about symptoms and examining the patient's nose. The doctor may also order the following test. Nasal endoscopy. A narrow tube with a small camera is inserted into the patient's nose. CT scan. This enables the doctor to locate nasal polyps and other abnormalities linked to chronic inflammation. The doctor will also be able to identify any other obstructions. What is the treatment for nasal polyps? The following treatments are commonly used for nasal polyps. 1. Steroids. The doctor may prescribe a steroid spray or nose drops, which will shrink the polyps by reducing inflammation. 2. Steroid tablets. In cases of larger polyps or more severe inflammation, the patient may be prescribed steroid tablets. 3. Other medications. Other medications may be given to treat conditions that are making the inflammation worse. Examples include antihistamines for allergies, antibiotics for bacterial infections, and antifungal drugs for fungal allergies. 4. Surgery. Polypectomy. This is the most common procedure for the removal of polyps. The patient is given general anesthesia. A long, thin tube with a video camera is inserted into the patient's nose and sinuses. Polyps are then cut out using microtelescope to visualize it and surgical instruments to cut it. After surgery, the patient will most likely be prescribed a corticosteroid nasal spray to help prevent reoccurrence.